In this video, we'll be concentrating on examination of the spine. This is clearly a massive issue given the number of days off work that people have in this country due to spinal and back injuries. It's also very important to try and work out whether the problem is a simple mechanical problem, such as caused by an injury to the back, muscle spasm, or whether it's a more sinister problem. Outside the age range of 20 to 55, certainly it's important to investigate fully to make sure that we're not missing any more pathological conditions such as a tumour, metastatic deposit or an infection. General health of the patient as well as the full history of back pain and problems into their legs is very important. We'll now move on to examining the spine. Examination of the spine starts with our patient fully exposed, as you can see. We need to check for alignment both anteriorly, if you just turn towards, and posteriorly, particularly looking for alignment of the spine right the way down. And from the side, if you just turn to the side please, looking to make sure the lordosis is neither increased or decreased, to make sure there's no increased thoracic kyphosis. Okay. To check movements, if you turn back towards the door for me, please. You ask your patient to bend down, try and touch their toes as far as you can, checking for the alignment, making sure there's no change in the rib profile as we come back up, as they go down. I'd like to come back up again and checking for spinal, sorry, just go straight. Checking for spinal movement by putting a finger on spinous processes and then asking the patient to bend forward again, please. And making sure that that expands. This is a modified Schober's test. Up you come, and then lean right the way back for me as far as you can, making sure you support your patient. Back up to normal, please. Just like to spread your legs just a touch so that you can slide your right hand down your right thigh, as far down as you can, please. And then the same on the other side. Again, checking for symmetry and any obvious problem with the movement. We need to check for tenderness down the spine, right from the length of the cervical spine at the top, pressing on the vertebra, supporting your patient's head gently and then their shoulder, otherwise you tend to push them forward and they don't really like that. Going down, checking all the vertebrae, the spinous processes as they come down, and then paraspinal muscles on both sides. Okay. Once you've done that, to complete the examination of the spine, you need to check the cervical movement properly as well. So if you could turn and face me, please. Okay. I always put one hand on the patient's shoulder to make sure that the movement that you have, is coming purely from the neck and not from anywhere else. So if you just look straight towards me, please, and then look across towards the door that way for me, please, and then back across that way. Back towards me. Pop your chin down onto your chest. Look up towards the ceiling for me. Then look back towards me and pop your right ear onto your right shoulder and your left ear onto your other shoulder. Okay, thank you. Any problems with the neck, we need a full neurological examination of the upper limbs and the lower limbs. Any problems with the back, we need a full neurological examination of the lower limbs. We'll now move on to examining the lower limbs on the couch. So we ensure that your patient's comfortable. We need to examine the abdomen briefly to ensure there's no intra-abdominal pathology that's causing a problem, and particularly also to ensure there's no full bladder, which would be indicative of a neurogenic bladder. Coming to the bottom of the couch and checking again for general alignment to make sure there's no obvious scars on the legs that could be causing issues. We'll check the pulses to ensure that there's no sign of a vascular issue which can be causing problems. We need to check the tone. Done very gently by rolling both legs, flicking the knee and the ankle briefly to ensure there's no increased tone, and then checking the sensation to make sure it's the same on both sides. So have L1, L2, L3, L4, L5 coming down the side to the first web space, S1 laterally, and then on the sole of the foot, and then coming up posteriorly. If we can check the power now, if you lift your leg up for me, please, and just push down against that. This is checking hip flexion, which is L1, L2, and then try and squash my hand down to the couch, which is hip extension, which is S1, Bend your knee up for me, please, and try push my hand away. So straighten your leg out. So that's knee extension, which is L3, L4. Then pull up towards you, knee flexion, which is S1. Coming down to the ankles, we need to check for dorsiflexion and plantar flexion of the ankle. So pull your hands towards me. So pull your ankles towards me and then towards you, and then push me away. And then the same with the big toes. So touching EHL and FHL. So pull the toe towards you and keep it there, and then push me away. Same on both sides. Go on to testing the reflexes. Just relax for me as much as you can. We're aiming for the comparison between both sides. So the patellar reflex. Coming down to the ankle jerk. If you have issues getting a reflex like this, two simple things to do. One is to flex the knee and bend the ankle and check there. So if you just put your hands like this for me across your chest. Okay, I want to ask you to pull. If you could just pull as hard as you can, please. Okay, so pull, please. And you can see there's an increased reflex when doing that. Just relax that back down. And checking the plantar reflex by running something soft at the bottom of the foot, checking for the toes coming down first and make sure it's not an extensor reflex. Don't use keys or the end of a tendon hammer because it's too sore and hurts the patient's feet. If someone has a problem with a potential sciatic irritation, we need to check on that. So if you lift your leg up straight for me, please. Straight leg raise. Usually this comes up to about 30 to 60 degrees, and when someone starts to get a problem, just relax for me. Lower it back down by a little bit. Dorsiflex the foot, which could cause irritation coming down the back of the leg, which is Lesag's sign. And also testing the bowstring sign, hip at 45 degrees, knee at 45 degrees, and checking for sciatic nerve tension by pressing the popliteal fossa. Okay, can you just roll over onto your front for me, please? Okay, this gives you, again, an idea of checking the muscle bulk, but we can also do the femoral stretch test by pulling the leg back up. And if you can just roll back over for me onto your back, please, and then sit up on your couch with the legs out straight in front of you. Brilliant, thank you. This replicates a 90-degree straight leg raise as well. And obviously we'd like to examine the top of the spine and the hip to ensure that we're not missing pathology from here.